Okay, so we're going to talk about a very specific part of the anatomy. This is the VMO, vastus medialis obliquus, and so this has to do with the patella, the kneecap. So if we're looking at that muscle, it sits right about here on the inside. So we have four muscles in the quadriceps. That's why it's called quadriceps, because there's four of them. We have an outer muscle, an inner muscle, and two in the middle, one on top and one below. The VMO is actually a portion of the VM, or the vastus medialis, and it comes in through here. And so the role of that muscle is to help control the kneecap, tensioning it on the inside to keep these muscles that are oftentimes tight and overworked on the outside from pulling your kneecap out, which can cause a lot of wear and tear and rubbing. It kind of sits, it's like your kneecap sits in this groove and it glides in there. But sometimes if those muscles are tight, it'll pull that kneecap out here and it will rub here, or it will pull and overstretch the inside of the knee, causing pain and stress in there. So oftentimes people have pain on the inside of the knee. So what we want to do is we want to activate that muscle and make sure that muscle is activating, and make sure that we can incorporate that into our weight bearing and loading patterns, especially as we bend and straighten the knee. Now the muscle fires throughout the entire range of motion with bending and straightening when you can feel it in all ranges, but it fires mostly in terminal knee extension, or at least the last about 10% of your range of motion here. When you straighten, it's going to really fire on the inside here. So it also, being on the inside, it goes along with the adductor muscles, so they work together. So, and also the innervation coming from your spine is similar in this flow through here from the femoral nerve. So what we want to do is we want to try to imagine, I call this the bug squash exercise. So think about your tripod, your heel, your pinky toe knuckle, and your big toe knuckle. You want to get all three of those points on the ground, and you want to try to square yourself up with good posture. But you want to really give emphasis to that big toe knuckle, not the big toe, but the knuckle. You're going to push down through all 3 points, but really push in there. And you want to adduct just a little bit, pull that knee in, or like imagine you're squeezing or hugging pillows, not like this, but like this. And when you push down on one or both, when you feel the outer and the inner muscles here, you should feel that inner muscle kick on quickly and really firmly. You should feel that muscle bulge really well there on the inside, right about in here. So again, find your kneecap about 45 diagonal out and in from there, and that's around where you should feel that muscle engage. Compared to the outside one, they should kick on. I can shift and kind of squash that bug on the right. I can squash that bug on the left, and for me, I feel like my left fires a little bit better than my right, so my right's a little sluggish. Makes sense, because occasionally I have some knee pain on that side, and that's probably what's going on. So I want to make sure that I can engage my arch, my 3 points, and that muscle together. I'm going to stand up now, and I'm going to think about this. If I'm kind of really trying to squash a bug here, I want to try to get that weight over top of that arch, and especially in that big toe knuckle, and push down there. I want to feel that, make sure it's firing compared to the other side. Same thing, okay? And when I walk, don't need to take long steps, really just short, kind of normal kind of steps, but make sure I can really bear that weight and kind of sink down a little bit, bending that knee and squashing those bugs one at a time. You want to make sure you can connect with that and feel that and practice that, and that should help with chronic knee pain.